Hey guys, my name's Zach with Apollo Health Insurance. Today I wanted to hop on and talk about health shares. I hear a lot of misconceptions and confusions around what they do and what they don't do and how they differ from traditional insurance. So let's talk about it. Let's start with they are not health insurance. Again, not insurance. The biggest reason why is because they don't cover any and all pre-existing conditions. Now, the first big question I get after I state that to a potential client is, oh, I'm healthy, I don't have a pre-existing condition. There's a lot of misconceptions around what that actually means. So let's break down the definition. A pre-existing condition can be one of three things. Number one, you have signs and symptoms of a condition or of an illness. Number two, you've been diagnosed with something by a doctor. Or number three, it's something you're already treating or managing through medication or through going to see a doctor. Any of those things that are medically documented, usually within a look back period, which is how far they look back before you enrolled for the plan, that is what could be considered pre-existing. So the biggest thing to ask yourself is what potential risks could be associated with that? And is there anything major going on that could result in a lot of medical care that could be very expensive? So once you understand that, for a lot of people, they have pre-existing conditions technically, but they're pretty minor and they're well managed. So generally, that's not going to be a major issue. The next thing is it's not tied to your taxable income, like a lot of the traditional insurance plans are on the marketplace. So their premiums are a lot more affordable because they don't cover pre-existing conditions, and they're just simply based on the state you live in and the age of the primary person. So typically the rates in the short term and in the long term stay a lot less expensive than traditional insurance, typically by about 30 to 40%. Second thing to understand about health shares that they don't do compared to traditional insurance is they don't cover any and all services day one. What do I mean by that? They traditionally have things called waiting periods. So like things for annual checkups or getting maintenance visits covered at the doctor, they have a waiting period in place. Now, why do they do that? They ultimately do that because you can buy these plans year round. So you're not subject to an open enrollment period like what just ended for the marketplace. You're not subject to a window where you have to buy a plan. You could buy it year round no matter your situation. So to prevent further rate increases and to make sure for their existing members their rates stay as low as possible, they put in a waiting period just to make sure that new members are going to be on the plan for a certain amount of months before they go in for annual checkups, getting their meds refilled, getting blood work, things like that done that a lot of us do at the doctor each and every year. So that's another important thing to be aware of is waiting periods and how they handle pre-existing conditions. Now, a couple other misconceptions I hear around health shares is, hey, they don't cover anything at the doctor, mainly just because of the benefits. I got to pay everything out of pocket before they start covering anything. Another big thing is no doctors ever accept it. There's no way to get a doctor that's in network. Let's unpack that really quick. First thing about doctor benefits, a lot of these health shares actually do have some basic doctor benefits that are the exact same benefits that a traditional insurance plan have. Take, for example, your annual checkup. That's a standard feature on all traditional insurance plans where you get annual checkups covered for preventative screenings, wellness checks, immunizations, all other types of preventative services. Some health shares also offer that same benefit. You can go in once a year, covered at no cost, and you can have those preventative screenings and services covered 100%. The other thing is they also have benefits that are not considered copays, but they function the same way as a copay, meaning you pay a set price if you have a sick visit or a maintenance checkup to a doctor or you're getting something looked at by a specialist. You pay a set price for that visit, and then everything billed from that visit by the doctor is covered 100% by the health share underneath that set benefit that you had, same way as a copay on a traditional insurance plan. So those are some of the benefits you can find on a health share. Now let's unpack one of the other big misconceptions about networks. And hey, every single time you go to a doctor, they're never going to accept it. You always have to get reimbursed. Well, in some cases that can be true. Depending on the doctor's offices, it's not always the case. And the majority of the time it's not, because some health shares still have access to insurance networks. It's not an insurance product, but they have access to an insurance network. Here's a great analogy that I give people to help understand that. Take Mint Mobile, for example, the company that Ryan Reynolds owns. They have the same type of cellular data plans that T-Mobile has, but it's directly through them at a much more affordable price. But in terms of their network, you're still getting access to the T-Mobile cellular towers. So you still have the same big, broad network that T-Mobile advertises nationwide. It's the same way as a health share if they have an insurance network. They're still going to have a PPO insurance network, which means you have preferred nationwide access. So you can still get access to 1 million+ doctors and hospitals that are contracted with that PPO network. That's how they still provide you premium access to go pick and choose doctors and hospitals that you want to see. Another key thing about buying a health share plan is you want to make sure you understand the process of how the health share operates in terms of what happens if a doctor's office doesn't want to bill the health share. How does that claims process work? How do they process it? How quickly are you still going to get coverage? How do they still give you a discount from whatever the doctor billed? Other things would be like, hey, how does a pre-authorization work, which is a traditional term for insurance? How does that work if I'm trying to schedule a major procedure on a health share? What is that process? How does it work? And how do they approve and deny claims on the back end? Those types of things are going to be really important to make sure you fully understand all aspects of you potentially using your health share plan. So the biggest takeaways from this are education. Make sure you're educated on the differences from traditional insurance and health sharing plans, what they do and what they don't do. And then the other thing I would say is make sure you know what your biggest priorities are, because in today's individual insurance market, there is no perfect plan. There is no one product or one approach that fits all. You've got to be able to identify what are some of the key things you're trying to accomplish. Is it saving money? Is it your access to doctors? Is it your out-of-pocket exposure should something bad happen to you? All of those things can be a big factor, so make sure you identify the top 2 or 3 things that you want to accomplish on an individual plan. That's going to be the best way to figure out if a health share is a good fit for you. We'll see you guys next time. Thanks for listening.